Sleeping in a hospital is not easy. They're brightly lit and they're loud, which are not ideal sleep conditions for most people. They're also busy. Nurses and other staff drop in frequently to give medications, take vitals, draw blood, or perform tests and checkups, in many cases waking patients to do so. Some monitoring is necessary, of course. Medication must be given, some vital signs do need to be checked, and frequent monitoring is needed for some patients, like those in intensive care units. But others are best left mostly alone. Despite this, many hospitals don't make this distinction, and they disrupt all their patients on a predefined schedule. Peter Ubel, a physician scientist, understands the problem as both a physician and a patient. When he spent a night in the hospital recovering from surgery in 2013, he was interrupted multiple times by blood draws, vital sign checks, other lab tests, as well as by the beeping of machines. Quoting him, "Not an hour went by without some kind of disruption. It's a terrible way to start recovery." It's more than annoying. Such disruptions can harm patients. Short sleep durations are associated with reduced immune function, delirium, hypertension, and mood disorders. Hospital conditions, including sleep disruptions, may contribute to post-hospital syndrome, the period of vulnerability to a host of health problems after hospitalization that are not related to the reason for that hospitalization. It's an environment that all too often seems set up for everyone else's convenience but the patient's. To help patients deal with the stresses of hospitalization, sedatives are often prescribed. These medications, including opioids, carry their own risks, such as addiction. Solutions aren't hard to fathom, and Dr. Ubel listed some in 2013. Hospital workers could coordinate so that one disruption serves multiple needs. A blood draw and a vitals check at the same time instead of 2 hours apart. Or they could allow patients' needs to guide the schedules. If a patient's at low risk and can go 6 or 8 hours without a vitals check, for example, perhaps don't do that check once every 4 hours. Small changes in hospital routines like these can go a long way. A clinical trial to test them found that they significantly reduced the proportion of patients reporting hospital-related sleep disruptions, and they cut sedative use in half. These small changes can even increase patients' ratings of hospitals, which are now a part of Medicare quality measures. The key insight seems to be to prioritize patients over tests and other interruptions that can be deferred. Some hospitals are trying to allow patients to get more rest. Yale New Haven Hospitals empowered nurses to change medication schedules to minimize sleep disruptions and to tick off other tasks before patients go to bed. Another example, to reduce noise, Massachusetts General Hospital in Boston has installed rubber floors in some areas. The University of Michigan Health System has taken steps to reduce noise at night, including changing when floors are cleaned and installing sound-absorbent tiles. Being sick and hospitalized is bad enough. Being subjected to sleep deprivation adds insult or more injury to injury.
When Monica McComb returned home from the hospital, she didn't think about nutrition as being essential for a full recovery.
I was really, really weak. I could even hardly walk with the cane.
McComb didn't associate her weakness with malnutrition until she was evaluated.
Malnutrition is invisible to the eye, and therefore it remains underdiagnosed and undertreated.
McComb enrolled in a home health care program and was given a detailed nutrition plan. Most Americans have access to food, but 1 in 3 patients in home health care are malnourished or have some nutritional deficiency that puts their health and their recovery at risk.
Nutrition is not the primary reason why patients usually come to home health. However, it is important for us to pay attention to the nutrition to promote their strength and get them recovered quicker.
Researchers from Abbott and Advocate Healthcare wanted to find a way to reduce hospitalizations and promote patients' health. In a study funded by Abbott, the researchers found that when patients on home health care got education about nutrition, they were nearly 20% less likely to be hospitalized or rehospitalized in the 90 days after an injury or illness.
Through identifying the patients at malnutrition risk, feeding them with the right nutritional drinks, you are increasing their chances of recovering faster, not going back to the hospital, or not going to the hospital in the first place.
One of the study's goals was to create a program that patients could follow on their own. One reason the patients were educated about nutrition.
And their outcome is so much improved. They have more strength, they heal quicker, they have less falls, they have less readmissions.
The researchers hope other healthcare programs and hospitals can use the study to help other patients as well. McComb says she feels stronger and has more energy than she had at the start of the program. She credits support from the home health nurse and the focus on nutrition for her improved health.